And talking about wherever you find yourself, I'm going to say a big good morning to all the people from the southwest region of Cameroon. Hello, how are you doing? Especially in Buea, because I heard something great happen to all of you this weekend. And it's great news to all of us because we're happy when one part of Cameroon is satisfied. That's why the show is called Unveiling. So the Buea Regional Hospital now has an effective method of dealing with the acute water crisis plaguing the area. I don't know if you've been to Buea before, but you know, water issues really are an issue. Water is really an issue over there. The difficulty to access places where you can get clean, potable water. That's why sometimes you get cholera epidemics happening around there, because the water system is really hard to deal with. And then people from that area looked at that. They're like, this is a problem happening in our place. What can we do about it? We're talking about people from that area. We're talking about the Wholesome Health Promotion that just supplied a borehole in Buea. It's great news, and Robert Iwari was there to cover this.
Access to potable water in Buea and Cameroon at large is a problematic situation, especially when it comes to medical uses.
There are many areas in our community, even in Buea municipality, don't have water. You see young children carrying buckets every day to go to streams that are no more safe because even the water catchments have all been polluted because with buildings around and toilets all over the place. That is where people go to fetch drinking water, which causes a lot of health hazards.
The Buea Regional Hospital can now survive this acute water crisis. It's not up to 7 weeks that the Wholesome Health Promotion donated a borehole in this hospital. Today we are in the unveiling process.
Water is largely in short supply in Buea presently, and he who has water in Buea is very, very rich. And I think that Wholesome Health Promotion has made me and the entire regional hospital of Buea and its patients very, very rich by augmenting our water capacity.
I remember I have been an eyewitness. I came here one day, I think we had some removal of corpse in the mortuary, and I saw a friend. They came right from Manfe for dialysis, and they couldn't have the dialysis that day because they said there was no water. So how dangerous is that? You are not sure whether the person going back to Manfe will reach Manfe. Can die because he didn't have the dialysis that day. So this is a wonderful project. We are very, very grateful to the team for bringing this project, and it is going to save a lot of lives. And as I said earlier, it is not only for the people of Buea municipality, because this center serves, I think it's the only center so far for now in the southwest.
This borehole was made possible due to the individual contribution and partners organization of the diaspora under the leadership of Therese Tandy, the founder, CEO and board chair of the Wholesome Health Promotion, a non-profit organization launched in the United States of America in 2017. It has as goal to provide wellness and health education in underprivileged community in Cameroon.
I think we all know that water is life, and they say health is wealth. And for our children, like Therese Tande, who is from abroad, and she was able to come up with projects to improve the lives of people in their country, Cameroon, and to provide health. I think that is something that we all should applaud and emulate.
We're here today to unveil this project, and I am very proud of my donors. I couldn't do this all by myself. The team in Cameroon and my US-based team as well. I possibly cannot raise all the funds, do all the man work and the legwork on the ground to make everything possible. So I'm also here today to say thank you to everyone who sees the vision. Thank you to everyone who continues to support me in this journey.
Present in the ceremony was some administrative, society and traditional stakeholders, such as the paramount chief of Buea, who could not hide this expression.
When we see people doing such initiatives, it really warms my heart. And that is coming from abroad. It even warms my heart even for that. Because just yesterday we saw news that Cameroonians abroad, just for 2022, for money they've pumped into Cameroon is 238 billion. So there's a lot of potential abroad from Cameroonians who can really lift us up from where we are. We should stop depending on government. The great American President John Kennedy once said that think of what you can do for your country instead of what your country can do for you. That's how we Cameroonians should have to shift our minds a little bit and start thinking that we have a lot of potential outside of Cameroon, even within Cameroon. Some of her donors, I saw the list when she was raising these funds, came from Cameroon. And none of them was some government agency. So we want to look at her like role models of the direction and vision in which we want to take Cameroon, that there are things we can do for ourselves, by ourselves, with ourselves, if we cooperate.
My motivation is actually myself. I have been motivated all through the years that we are capable of doing anything that we can possibly do. Like His Royal Highness Chief Indeli said, we shouldn't wait for the government to do everything for us. We as citizens have to do our little part. And I'm here today as I have rallied all through the years, my team, donors, patrons, friends, family, to help me see the vision. I am here also to tell you guys that we should not always wait for the government to do things for us. As individuals, we can do our own little part to make our communities better.
Some 2 years backwards, WHP donated a similar borehole in the Tico Cottage Hospital. And up to today, there is no water crisis in this hospital.
We in Tico have enjoyed this opportunity. We had it 2 years ago and it is very, very effective. We don't lack water in the hospital.
Wholesome Health Promotion is 5 years old, and today its achievements will be extended to other community projects.
What next? I'm looking to drill another borehole somewhere around the Buea area or the Limbe area. This time around, we may look for a community in need of a borehole, not just a hospital.
It must be noted that the Buea Regional Hospital consumes 60,000 liters per day, and with an additional 10 liters per day, thanks to the Wholesome Health Promotion, the demand and supply curves are almost getting to equilibrium. What a good news for the population.
Wow, what is a hospital without water? It begins with cleanliness around, and big thanks to you, Robert Owari, for this report, and bigger thanks to Therese Tande and her team for making this possible. And as the Paramount Chief said, you look around you, identify a problem, and provide the solution. Instead of identifying a problem, because we're good at that, pointing, oh, there's a problem here and there, and then saying someone else should do something about it. Start by saying, oh, there's a reason why I'm seeing this problem. There's a reason why God is showing me this problem. It means I have the ability to do something about it. What can I do? And let me do it, just like Therese and her team did. That said, if you're just joining us, it's Cameron Feeling live on CRTV.